So you may have always heard about a deviated septum, that partition between the right and the left nostril that should be right in the midline, but a lot of times either it's deviated over or, as in this case, the entire bone, rather than being nice and straight like a flat wall, is actually angled and has this huge piece that's sticking out. Now, I'm gonna take it out right now. Hold on a second here, I gotta grab it. And then I'm gonna slowly pull it out. Here it is. And that's the partition. This area right here is the wall, right? And this wall should be as thin as it is, right? It should be this thin, but look at this huge piece of bone sticking out like that, okay? And that's what's causing so much problem and obstructing the airway. So I'm just taking this little section out right there. That little piece is causing a huge problem.